Okay.
Thank you so much, bro. Okay.
How do you think you are going to get sick?
Doctor, are you still off the
Record.
camera?
Don't worry, I'll start record. So just stay with me to understand.
Okay.
Okay, don't go for good.
Doctor, I cannot see anything. It's completely dark.
I will start. Okay, I'm making you video, so stay and everything's visible. Just to understand, like watch with the video, I don't know, because you will spend a lot of time. Anyway, we did parasympathetic, so today we are going to do sympathetic. Sympathetic system of fight. System, let us just put it like simply during the day activity. Sorry, system of the physical activity. And this system, they call it adrenergic system. Why? Because the neurotransmitter, it is adrenaline. That's why they call it adrenergic. With the parasympathetic, because the neurotransmitter acetylcholine, we call it cholinergic. So this system, the sympathetic,
it's adrenergic.
Sympathetic, they call it adrenergic. In adrenergic, what we have? Let us beginning. We have like alpha 1, alpha 2, and we have beta 1 and beta 2. See, alpha 1, you know what is it? What they bring it. See how you write like alpha 1, like this one, right?
Mm-hmm.
So just put it with the eyes.
Mm-hmm.
In the eye.
Alpha 1?
Yeah, in the eye. This is what they bring you in correct question. Alpha 1, just remember how you write. This is like the alpha, just match it to make what is eyes. So alpha 1 is located in the eye. And with the visuals. Some students really, they are confused. Is it dilation? Sometimes because you are stressed with the exam. You know, like if we make like, for example, this is alpha, like, you know, like when you're stretching, like you crossing something, you are making what is more strong. So because this cross alpha 1, it's making vasoconstriction. Vasoconstriction. So alpha 1 is making vasoconstriction. And when we need the vasoconstriction, we need it with the vessels. Commonly with the blood vessels. Blood vessels everywhere. All the vessels, all the body.
So all blood vessels.
Yeah, sometimes when you are scared, you get what is pale. Why we get pale? Because vessels constricted, you scared, right? And the vessels, like when constrict, like decrease blood flow to the skin, and the skin is getting what is pale, like the face like look like pale. Why? Because alpha 1 adrenergic, like fear. You fear from the exam. You fear from, for example, like fall down. You scared maybe there is dinosaur running around you. So your face become what is pale. Why? Because the vessels is constriction. And where is alpha 1 also? With the when we do exercise, we retain the urine. We are not urinate on ourselves. It's also what the alpha 1 located where? In the urinary system. This is urinary bladder. And here is the urine. Here we have the prostate. Here we have, what is the prostate? Yeah, here is the urethra. And here we have prostate. You know what is the main key word about the prostate? See, for example, this is the urethra, right? This is the urethra. It is the prostate is surrounded the urethra, enclosed the urethra. You understand me? So prostate, when we choose it, whenever we find surrounded urethra or enclosed the urethra, We draw like this one because this is like in the whiteboard to write it. But to understand it, this is the urethra. For example, here urinary bladder, and this is the urethra. So prostate is surrounding what? The urethra. If the prostate is enlargement, they call it benign hyperplastic, benign prostatic hyperplasia. So this because increased number of cells, and this one is compressed on the urethra. So people with prostate, they can difficult to urinate. If they urinate, they have what is painful urination. Why? Because they afford like pressure on the urinary bladder to push the urine out, and here is obstruction. So it's getting what is painful urination and frequent. Why frequent? Because when he urinate like small amount. Each time, like each one, like for example, 1 hour, 30 minutes, the bladder, it's like full and push what? To the urethra. That's why they urinate like small and more frequent during the day. So alpha 1, it's also with here, with the urinary bladder, with the urethra, with the sphincter. Here we have alpha 1. It's make what? Constriction. And if we constrict the urethra, we make what is urine retention. Urine retention. You get it? Urine, yeah, we get it. What is urine retention? And now let us, how we made the, in the beginning, how we made the parasympathetic, the acetylcholine we synthesized. And now let us synthesize what? Noradrenaline or adrenaline. See, it's the same. For example, here, precentral. Here we have the precentral, and here synaptic cleft, and here postcentral, and this is target tissue. Target tissue. See. Here from tyrosine, because not other tyrosine. Tyrosine, it's amino acid. Tyrosine will convert to L-DOPA. Sorry. L-DOPA. And they call it really, one time they bring you L-DOPA. This is levodopa. Levodopa will make dopamine. And the dopamine make what is norepinephrine. Now let us come for the crook question. They bring you dopamine and they ask from which amino acid is synthesized. Dopamine is made from which amino acid? Tyrosine. So this is guys with a crook question. They give dopamine and they ask about what, which amino acid. They give you tyrosine, phenylalanine, histidine, like different amino acid, tryptophan. So they want to ask, like to know if we know like which amino acids. So tyrosine converted to levodopa, levodopa to dopamine, and dopamine make what is norepinephrine. They give you, they never, if they bring you dopamine, we choose what is tyrosine. And norepinephrine is also synthesis from the tyrosine. This is the two questions they bring it in the croak. Muhaddisa.
Sorry. What is after dopamine?
Dopamine, norepinephrine, and norepinephrine. No, Muhaddisa, right.
Okay. In the question, they say that norepinephrine from where says that we choose dopamine or tyrosine.
No, they give you, they ask about amino acid. Dopamine, you know, it is hormone. Who's using dopamine?
Depressed people?
No, people who has like challenge, like champion, like who's like for this bodybuilding, because dopamine increase the power of the muscle. So you can carry like 200 kg. It's giving you what? More power to carry like heavy weight. Muhaddisa, can you tell me what is meaning of depression? Your friend called you and you told, oh, I'm depressed. I don't want to go to center with you. I don't want to go from my home. I'm depressed. What is depression?
You mean about the certain connection and the company's decrease in depression?
Yeah, when I'm depressed, why I don't have mood to go out? I don't have adrenaline to walk, to make me walking. I don't have serotonin to give me mood to go out. Depression, its meaning decrease adrenaline, noradrenaline, dopamine, and serotonin. This is how we defined what depression. So depression is decrease adrenaline, decrease noradrenaline, decrease dopamine, and decrease what? Serotonin. This is how we define what is depression. Why I am developing depression? Why? شمو.
Because of the enzyme.
Which enzyme? Excellent.
Monooxidase.
Yeah. Monoamine oxidase.
Yeah,
See,
monoamine.
in the presynaptic ganglion, presynaptic, I have here enzyme, they call it monoamino oxidase. What is doing this monoamine oxidase? See, when the calcium calcium enter here in the preganglion, this norepinephrine released. And what we have, which receptor here? Nicotinic receptor. Here, nicotinic receptor, right?
Norepinephrine.
Huh?
For norepinephrine, we have
Yeah,
nicotinic.
yeah. And some of norepinephrine, its reuptake and storage where in the vesicle.
But Dr. Nicotinic is cholinergic receptor.
Yeah, cholinergic present in the sympathetic and parasympathetic with the nerve. Clear? So some part of norepinephrine, it's reuptake. They call it, what is reuptake? Reuptake. And here they storage where in mobile pool. They call it this one storage mobile pool. Monoamine oxidase making chemical process, they call it oxidative. This enzyme making oxidative deamination. This is cross question many years. This oxidative deamination with the monoamine oxidase is breakdown norepinephrine and make breakdown and degradation. So this enzyme, it's break down this norepinephrine. So if we don't have norepinephrine in storage, the norepinephrine will consume, body can use it. So we decrease of norepinephrine. Norepinephrine take all dopamine converted to norepinephrine, body can use it, and we decrease what is dopamine. That's why we have monoamine oxidase. If activate this enzyme, it's making what is depression. So if we want to make anti-depression, what I should block this enzyme. Blocking, they call it anti-monoamine oxidase. So in simple way, is it clear to everybody?
Yes.
Okay, see, we go back. See, here we have the storage. if we have active enzyme, this enzyme will degrade, like break down the norepinephrine, which is storage. Because you know this is storage form. When we need noradrenaline, this storage release noradrenaline and give it to the tissue. So if we break down this storage, we don't have noradrenaline. This noradrenaline used by the body. So now level of noradrenaline drops.
Norepinephrine.
Norepinephrine is the same. When we decrease this one, noradrenaline will consume dopamine. So when we consume dopamine start to drop. So if we decrease dopamine and norepinephrine, we develop what? Depression. So if we want to make what? Here is like anti-depression, I need to block this enzyme. So block monoamine oxidase. Is it clear?
Yes, sir.
This is Crocker questions many years. Whenever
Doctor, sorry, one question.
Whenever we find in the question depression, we need to think this is monoamine oxidase. Whenever they ask like antidepressant, we need to choose anti-monoamine oxidase. We block this enzyme. And whenever we find monoamine oxidase, we think about oxidative deamination, because this is the chemical process to degrade and break down the noradrenaline storage form. Yeah, Archie, you have a question?
Yes, doctor. What was the job of the monoamino oxidase?
Break down the storage form of noradrenaline, like make degradation. So if noradrenaline degraded, we don't have it. We cannot supply noradrenaline, so noradrenaline drop. And if noradrenaline drop, it's
Dopamine.
consuming the dopamine. In the end, dopamine and noradrenaline drop, both of them. Claro?
Yes.
So now let us do this one about monoamine oxidase and depression. Let us do what? Alpha 2. Why? Because which drugs, what is the effect of noradrenaline? Noradrenaline make vessels constriction and increase cardiac output. So let us also do this one.
For R2, alpha 2?
No, just like general,
Okay.
like with the central antihypertension. See, did you read the question? Pharmacology about parasympathetic.
Yeah.
You finished all.
Test?
Yes, the test.
At home.
At home we do.
Yeah, at home. Yeah, you need to like to work hard, like fast. See, noradrenaline is making vasoconstriction. And when we make vasoconstriction, we increase blood pressure.
Hypertension.
Yeah, increase blood pressure. And also noradrenaline increase cardiac contractility. No.
Cardio.
Contraction. When we increase cardiac contraction, we increase cardiac output. This is CO is a C cardiac output. Output the like pump the blood from the heart. If we define this is hypertension. Hypertension equal. What is hypertension? It is cardiac output multiplied by total peripheral resistance. Cardiac output like CO multiplied by total peripheral resistance. Here multiply by total peripheral resistance. Yeah, here, total peripheral resistance. So see, noradrenaline increase cardiac output and increase total peripheral resistance. That's why increase hypertension. So if patient have what? Hypertension. If patient have hypertension, we need to decrease what? Epinephrine or noradrenaline, right? So there is drug to prevent. Here is release of norepinephrine. Release, like noradrenaline, norepinephrine releasing to synaptic left. There is drug, they call it what? Reserpine. See, R with the R. Reserpine, prevent, release. Here is release, right? Release, right? Release. If I want to prevent release, like I stop here, I block release of noradrenaline. Name of drug, they call it reserpine. So here what we have, reserpine, prevent release of norepinephrine. Just match reserpine with the release. This is the main key word. Yeah. Reserpine prevent release of norepinephrine. This is a crock. How they call it? Because releasing from the central, they call it central antihypertension. Clear?
Yes.
Because it is working with the nerve, so it is central antihypertension. They call it this one central. Are you with us or you get sick?
Yes, yes, doctor. But I have a question. What is TPR?
Huh?
Total.
Total peripheral resistance.
Ah.
Yeah, this total peripheral resistance with the vasoconstriction because with the vessels resistance. This is central hypertension. Arya, how you can define me the pressure?
Pressure.
Yes.
By the volume of blood and also the number of heart rates.
Okay, Arshia.
I'm gonna be sick, doctor.
Okay, Nikta.
Yes.
You are adult, you know, you are like
What?
doctors. There is no excuse, like how you know like you are going to be sick. This is maybe it can be in primary school, you tell the teacher like
No, not actually, doctor. We are already sick, you know.
Me and my sister actually I'm already sick too.
oh, you are fine, you don't look sick.
Yeah, we are fine, but I have a running nose, for example.
And this is not sickness.
But I'm already sick, doctor.
No, I feel, for example, weakness and so.
This is normal, you just take chai and that's all. You can
I
use
got
like
high
ibuprofen.
temperature.
Yeah, you
I
can
got
use
high
ibuprofen. Today we will take like ibuprofen. Yeah, just like simple stuff. This one, temperature, like headache, weakness, is not sick. Yeah. Yeah, no, ibuprofen really it's working better. Like
So
for temperatures,
ibuprofen.
weakness, it's getting much better. And take like soup, make soup and that's all. So, how you define the pressure? It is secondary school, guys.
Systolic, diastolic.
That's mean.
Define blood pressure, you mean, yeah?
The pressure normally.
It's 120 per 85.
Yes, I understood.
120, 80.
No, that one, blood pressure. See, guys. No, pressure equal tension over radius. Tension over radius. For example, this is A and this is B. What is radius? This is the radius. This is the radius. A, it has more radius, right? So if we increase radius, we decrease pressure.
Yes.
Right? But if we decrease, here is like small radius. If we decrease radius, we increase
the pressure.
pressure. That's why with the vasoconstriction, why in vasoconstriction we get less radius. And if I have less radius, we have high pressure. This is how you define the pressure. Clear? It's maskhara, you know?
Very much.
Yeah. That's why the pressure, whenever you think about pressure, think about resistance. And where is the tension? The wall. This is the wall tension. And which artery has highest resistance? Yes, because they are like a crock question.
Central.
Huh?
How?
No. Right. Arterioles. The smallest arteries. Arterioles, because the what happened? Small radius, the smallest radius, the arterioles, and they bring you highest resistant, we choose arterioles. So here I will write it here highest resistant, it is arterioles. It's croak many years. They
They
bring
don't
it.
break the lowest resistance.
No. Let us go back to our pharmacology. So you get the pressure. This is the pressure. We need what is total peripheral resistance and link. Otherwise, whenever there is hypertension or the pressure, just link it with the resistance. We choose the resistant. And highest resistance who's regulating the arterioles. This is about blood pressure. We will do in physiology of the heart, cardiovascular system. See. Now, let us do alpha 2. Alpha 2, you know, here in the preganglion, located in preganglion. Yeah, alpha 2 located where? In the pregangliona. Now we have alpha 2 agonist. If we activate alpha 2, it's going to decrease noradrenaline because alpha 2 it's located here in a preganglion. If we stimulate alpha 2, it's going what? To decrease noradrenaline. So if we decrease noradrenaline, we can call it also antihypertension. So we use it. What is the name of the drug? Clonidine or methyl dopa. So here clonidine or methyl dopa. This drug, they activate alpha-2, and when we activate alpha-2 decrease noradrenaline. So this drug, they call it also anti-hypertension. Anti-hypertension, it's also central. Why? Because located with the central nervous system. See. And what other question they bring you? They bring, is it in preganglion or postganglion? We need to choose preganglion. So what is the side effect? Side effect, don't tell me hypotension. Yes, Muhaddisa. Clonidine, C-L-O-N-D-I-N-E, clonidine, and methyl dopa. Methyl, yes. We get sleepy. Why? We don't have noradrenaline to be active. And what else?
Tired.
What else?
Depression.
Sluggish. What does it mean sluggish? Low movement. Because you know they bring you the side effect, this sluggish and the sleepy, and we choose a clonidine. They give you the side effect of drug in the question, and we choose what is, we should think about the side effect. So here is sleepy all the time, like student in Bagamolis, and they develop what is sluggish. Sluggish, like low movement. Yeah, sluggish, either low movement in WhatsApp. Jason.
This is for clonidine or both of them?
Huh? The hand. Haji? Yeah,
This is for both of them or just for clonidine?
no, both of them, they are working the same. Okay, now I catch you. What about alpha-2 activation? Like blocker, sorry. We block alpha-2.
Cocaine. Cocaine.
No cocaine.
No, so far we're using depression.
Alpha-2.
Alpha-2 blocker.
Yes, we did activation and then now we make what is blocker. I just write it to my students, but it's not correct. They didn't bring it before, but maybe they will bring it.
It's our chance.
So, what? Alpha-2 blocker. If we block alpha-2, what happened? Because alpha-2, when activate, is decreased norepinephrine. So if we block it, we increase what? Yeah, norepinephrine. Which drug? Why we need to increase norepinephrine? This is mirtazapine. Mirtazapine drug. Yes, I will write it, guys. Mirtazapine. We use this drug in case of impotence. Yeah, impotence. We use this drug in case of impotence. Mirtazapine.
How could you not say about alpha-1 drugs? It's not important.
Alpha-1 drug.
Alpha-1. We are going. Just we are walking like with the line, you understand, like step by step.
بچه عکس بگید از تخت قبل اینکه پاک کنم.
Yeah, you can take. Marjan, she will send you the photo. She's taking picture now. Yeah, mirtazapine. Saying what is impotence? Huh?
Impotence.
Yes. Marjan.
We use method.
What is impotence? Arya, you are good in English.
Potence,
Yani Muhammed yine mi sen?
I think comes from potential. Oh,
Impotence. What does it mean, impotence?
Oh.
Something that you couldn't help, helpless.
Huh?
Is it about sexual?
Yeah, sexual like inability.
Uh,
Yeah, like with the sexual, or sexual, we give them.
You
what is-
cannot get orgasm or erection.
Yes, so we give them.
So Mertazapam
Mertazapam.
kind of involved.
No, to treat impotence.
How to treat it?
Yes, to treat it. Clear?
Yes.
Is it Viagra?
No, this is not Viagra. That one, sildenafil.
Sim what?
That one, sildenafil.
Simdenafil. All right.
Yes, but this one, mirtazapam. Is it clear?
Yes.
Hussein, you use cocaine?
Yeah.
Sure. See. You know this
Sometimes you use.
reuptake? No, you know this reuptake? Cocaine block reuptake. So all noradrenaline here. That's why you can't stay 3 days without sleeping, like alert.
Also amphetamine.
You use amphetamine?
No,
Huh?
It's
just
knowledge.
information.
Yeah, amphetamine or
Cocaine.
cocaine. Yeah, they decrease what is, they block the uptake. Don't use, guys, this drug like is danger. Man.
Oh.
You could have like MI.
No, teacher, we're good at students. We don't need to.
Well, it's not depend on good or bad.
Oh, we just study.
Nikta, are you with us?
Yes, doctor, I'm here.
Good. Why
Yes,
did you
sir.
come today?
I told you because the university forced us to come for one class in the evening.
Okay, so we have alpha 1. Alpha 1, we have alpha 1 blocker, or alpha 1, let us take the activation, then we do what? The blocker, right? See, if we mention, for example, with the blood vessels, this is with
It's
the,
about alpha 1, right?
yes, alpha 1 activation. Or agonist. See, when we need to activate alpha 1, because this alpha 1 in the vessels, right? Why we need to activate this alpha 1? The function is vasoconstriction. When I need to make vasoconstriction, if the vessels dilated, right? So number 1, I use it where in vasodilation. I mean overdose of vasodilatation. And the drugs that make overdose, vasodilatation, it's what? Instagram.
You mean agonist of
Nitroglycerin. Nitroglycerin make what is vasodilation? Next, if I develop hypotension, if I have what is shock, in shock I have vasodilation. In case if I have what is collapse, in collapse I have high vasodilation and hypotension. In case of what? Ask.
It's about
Activation. When you need to activate alpha 1, it is in the vessels. See, alpha 1 make vessels constriction. When I need to make vasoconstriction, if the vessels dilated, when they dilate, they drop blood pressure. So they make what is hypotension. The drug that make dilation and hypotension, it is nitroglycerin. And if patient develop shock always presenting with the vasodilation and getting what is drop of the blood pressure, I need to give him what is alpha 1 activation. And if the patient develop collapse, coma.
Also in inflammation.
No, see, in inflammation we give anti-inflammatory drug, here coma. So we activate alpha 1. Which drugs they activate alpha 1? They call it mesotonium. Phenylephrine. Yes, they bring it. What is alpha 1 activation? They call what? Phenylephrine. Or to be honest, they bring this one. Mesotonium. This mesotonium. Mesotonium or phenylephrine. Phenylephrine. Yeah, but this one, to be honest, commonly they bring what?
Phenylephrine make the vasoconstriction or dilation. Doctor, the phenylephrine
Yes.
make vasoconstriction, right?
Yes. The same dot com. So this is with the alpha 1 histogram activation. So when we need to block alpha 1,
We have this conception.
when I have high level of norepinephrine.
Or maybe when the patient is in anesthesia or what?
No, we can do it. Okay, let us do. You see what happened. Is it clear? You
Yeah.
can send them photo. At least maybe they will write from the photo, like read the photo. Was he left? No, Nikita. Oh my gosh. Start.com. She went away. You're general medicine, right?
What?
You're general
Yes.
medicine. Yeah, because I just need to make a schedule for you to start with the booklet, for example. The student who study like general.
Mhm.
Okay. We have when we have a tube, like if we want to block norepinephrine, we give what is alpha 1 blocker. What we have, we will do it in endocrine, but just like to get the idea. Here we have the renal. Above the renal, we have what is adrenal gland. Here we have adrenal. Adrenal gland. With the adrenal gland, we have cortex and medulla. Here we have medulla. And here we have what is cortex. In the medulla, if they give what is catecholamine, the adrenal medulla, the medulla make what? Catecholamine. Catecholamine. Catecholamine, it's not adrenaline, it's adrenaline, and it is dopamine. Yeah, its synthesis what? Catecholamine. How to define catecholamine? It's adrenaline, noradrenaline, and dopamine. When we have, for example, tumor in adrenal medulla, how we call this tumor, Marjan?
Tumor in adrenal.
Yeah, here I got what is tumor. How we call this tumor? Archia, aria. We call it pheochromocytoma. Pheochromocytoma.
It's in medulla, right?
Yes, tumor in the medulla of the adrenal gland. If we have pheochromocytoma, meaning this is like cancer, you know, I will teach you like with the cancer. We have pheochromocytoma, we have high level of catecholamine and high level of noradrenaline, adrenaline, and dopamine, and patients start having hypertension, palpitations, supraventricular tachycardia. We will do it later on. So because of this release, where this is releasing in blood vessels and make what is vasoconstriction. So with this drug, I need to use what? Alpha 1 blocker. So that's why here we use what is alpha 1 blocker or alpha 1 antagonist. Yes, we use an alpha. So in pheochromocytoma, do you know the drug? No.
Why?
We have selective, we have non-selective.
Alpha blocker control. Teacher, what is the alpha 1 blocker?
I'm asking, or antagonist.
Antagonist.
Either they call it antagonist, either they call it what?
Mhm.
Blocker.
Mhm.
Phentolamine.
Antagonist.
Yes, phentolamine.
Then what it doing?
Is block alpha 1. And if we block alpha 1, we make dilation because this
So
noradrenaline,
it's
adrenaline.
blood, it's
Yes.
vasodilation. It's selective.
Yes. For the non-selective Hussein, that one, razozine, doxozozine, anything is ending with the zozine. This one, we use it what? Where? In benign prostatic hyperplasia. Here is the prostate. We did it before, and here what we have? Alpha 1. Alpha 1, it's make constriction. So if we have prostate, this is like narrow lumen of the place your prostate, like urethra, and urine is retained, retention of the urine. So we need to block alpha 1 to make what? Dilatation. So this one, alpha 1 blocker. Here we have benign prostatic hyperplasia. On brazozine, toxazozine.
It's a drug name?
With the zozine.
It's drug?
Yes, drug. Brazozine, doxazozine.
They are
Above.
doing the
They
making,
block alpha 1. When we block alpha 1,
so it's what dilation happen.
yes,
When
yeah,
they use
is it dilation? So
brazozine.
when they dilate it, then
Okay.
we start patient urinate.
So, okay.
Because stone can kill the patient really. The urine, if you don't urinate, this is the most tough situation with the patient. Urea can kill the patient. Yeah. Yeah, urea can kill the patients.
BPH, prostate hyperplasia.
Benign prostatic hyperplasia. Arsalan, right?
Yeah.
Arsalan.
Arsalan. Arsalan and Dari. Okay. Yeah, Daria also, she's general medicine. So this is the normal distribution of beta 1. If I have tachycardia, for example, if I have like supraventricular tachycardia, if I have arrhythmia, if I have arterial fibrillation, if I have like any type of arrhythmia, like heart rate more than 90, I need to give what? Beta blocker. If I want to block the beta, if I block beta, I drop what? Heart rate. Because beta 1 activation, it's an increasing heart rate. So beta blocker, it's decrease heart rate, decrease contractility. With the beta 1, I have rules. See, with the beta 1 blocker, Kimia?
Yeah.
She took beta blocker before the exam.
Really?
Yes.
Because of the stress? Or?
Because of tachycardia, she developed like she's scared and she developed heart rate. So beta blocker to decrease heart rate and she will write exam like normal. Yeah, some student I give like Arabian also, like one Egyptian also last year. He failed the exam because of tachycardia. He was so much scared. So second attempt, I gave him beta blocker and he did the exam well. Beta 1, we have selective.
And not.
This is depend on the alpha, on the letter, and non.
Doesn't get you to sleep, Dr. Beta blocker.
No. It's just regulate the heart rate. This is from A to M. Like atenolol. Any drugs start from letter A to M and ending by lol. We call it what is beta blocker, selective one. Here, metoprolol. It's start by M and end by lol. Like A, B, C, D, E to M. When the drug start from A to M, they are selective, meaning they are working only on the heart. So with the selective, we can use it where? In arrhythmia. Here they call it like anti-arrhythmic drugs. Anti-arrhythmic drugs. What about non-selective? It is the work on the heart and different tissue of the body. This drug is work on the heart and different tissue in the body. Like what? With the thyroid, sorry. It's work on the thyroid and the heart. It's work on the lungs. Working on the lungs also. Yeah, فقط قلب. Only heart. Clear?
Yes.
So let us do this one, propranolol. Propranolol, it started from P and ending by lol. So this is propranolol non-select. Can work what? Can work beta 1 and beta 2. Can work on the heart and the lungs. So here the drugs, they call it
That's like just propranolol or non-selective?
No, we have a lot of drugs, but this is the common question what they bring you. Propranolol, it's working beta 1, beta 2 blocker. Let us see. I think this one you can take photo and send to Arshia.
What was English of Anapril?
Anapril, what is Anapril?
The drug.
What is the mechanism?
I don't know. I was asking.
It's angiotensin converting enzyme inhibitor. We use it in case of hypertension. Anapril, cartapril, lanzapril,
To
and drug.
decrease the
Yeah, just
hypertension?
no. We will do pharmacology step by step. Just don't mix yourself. We will do it with the endocrine. Yeah, I just want to finish you with the general to start like other zoo. They already like they will finish endocrine system.
You're sitting in general?
Yeah.
میگن تو
Now beta 2? Or
No,
still-
yeah, we do like beta 2 with the Beta 1 non-selective, C. In the lung, what I have, beta 2. Just remember you have one heart, so put alpha 1. And you have two lungs, put
Oh, okay.
two lungs, it's beta 2. Yeah, just to remember. Like one heart, it's beta 1. Two lungs, it's beta 2. Here we have what is smooth muscle.
This.
Here we have beta 2. Beta 2, if we activate it, it's making dilatation of the bronchi. This is activation.
So we have dilation.
Meaning activation, it's agonist, right? Agonist. With the agonist, it's making bronchial dilatation. We are dilating if we activate what? Alpha 2, C. And now the scenario, Archie, Aria, and Nicta. Focus here. If I have bronchial asthma, this is the patient have bronchial asthma. What's bronchial asthma? It's bronchospasm here below. Bronchospasm. So this patient, should activate beta 2 or block beta 2? Should I activate?
Actually, you should activate.
Activate, right?
Yeah.
So can I block this beta 2 in case of bronchial asthma?
No, doctor.
Opa. So, you know, like propranolol, it's beta 1 and beta 2 blocker. Can I use propranolol in case of bronchial asthma? Because
No,
it's working on both. It's block beta 2 and beta 2 make a spasm. And the patient, he have spasm, he will die.
Yes.
This makes more sense.
Clear?
Yes.
So this one, what we tell propranolol contraindication in case of bronchial asthma. So propranolol contraindication of bronchial asthma. This is what the question they bring otherwise. Marjan, can you add me like as admin?
Yeah.
Okay.
So what we should use? Teacher, what we should use? Which drug?
Tell me what you use. We use alpha 2 agonist. Sorry,
Activation.
beta 2
Okay.
agonist, salbutamol, terbutalin.
And
Yes, of course I will write. So in case, because here, if I want to treat a bronchial asthma, I should give what? Like treatment. Contraindication of bronchial asthma. To treat bronchial asthma, we activate, and this is salbutamol. We give what? Salbutamol.
بیشتر
بیشتر
اکثر
You know about me? Okay, guys, now we are done with beta 2. Yeah, commonly this is the question they bring it, but we need more about the heart since we are working with the heart and sympathetic. You are dentists, guys, and you know local anesthesia better than me. What is the mechanism of lidocaine, novocaine? Why they use it like, is it like, can we use it for the heart or only dentist? Why and under what condition?
It's a demineralization,
Your doctor. Huh?
It's all the demineralization, repolarization.
So what's the
The sodium and potassium of the blood.
yeah, lidocaine block the sodium.
Sodium.
We use it where? As antiarrhythmia and as local anesthesia. For example, when we use it as antiarrhythmia, we use it post myocardial infarction. And we add, when you inject adrenaline, you inject lidocaine, you inject adrenaline to increase the duration of the lidocaine. So we have a lidocaine and novocaine. And they are type 1 hypersensitivity, remember that. See, here we have the action potential. Yeah, they call it the lidocaine anti-arrhythmic local anesthesia. Here is the action. What is the action potential?
When the
No, what is the action potential? Come on.
How is it?
they reach the threshold.
What is the definition? What is like this? Yeah, like in
Depolarization.
definition. We need definition. We don't need like hand movement.
There is when sodium
Come to Creshatic and potassium go to Kharkiv. No, guys. Action potential, because it's a proper question. That's why I'm asking you. Do you know?
Depolarization.
What depolarization, guys?
Action.
It is all or none.
action potential.
Action potential, it is all or none. This if you want to define action potential,
What is
because
all?
they,
It means if we don't have action potential, we don't have another action.
yeah, but I need
potential.
this word.
Mhm.
Because they bring this word like all or none in the question, we choose action potential. So when the sodium enter, you know, here we have basement membrane minus 90. So sodium when enter inside of the cell,
Mhm.
right? Sodium enter inside the cell,
Mhm.
it's making more positive, right?
Yes.
So it's like making like from negative to the positive. So minus 80, minus 70, minus 55. Here threshold. We reach what is threshold. Here we have threshold. After that, bless you. After that, here we have the depolarization. When the sodium enter, it's getting what more depolarized. And this depolarization so sodium channel blocker we have here we have they are where is night they are like block sodium channel. Lidocaine, novocaine block sodium channel. So if they block sodium channel, there is no depolarization for the nerve. That's why we don't feel the pain when you are making, like working with a dentist.
For surgery also.
Yeah.
Mhm.
So we give what they add drug. They add with the with the lidocaine, they added adrenaline. Why? Adrenaline, it has 3 questions. Number 1, it's making vasoconstriction. And if we constrict the vessels, to stop bleeding, to decrease bleeding when you are working with a dentist. This is croc, like making vasoconstriction adrenaline. And the second, increase duration, increase duration of local anesthesia. Increase the duration of local anesthesia. Okay. So lidocaine, novocaine, how they call it, local anesthesia and antiarrhythmic. They bring this question, antiarrhythmic drug.
Anti what?
Yes, antiarrhythmic.
Arrhythmic.
Yes, antiarrhythmic, we use it where? Post myocardial infarction. We use it where? In post myocardial infarction. We use it in case of post myocardial infarction. Is it clear? Sure.
He doesn't look, he's a sailor, you know?
Yes. Yeah, with the nerve also, I want to teach you with the anatomy because they bring a lot with pain in nerve. fascia, trigemina, the ganglion, foramen. But anatomy, I will put it like close to the booklets, you know, in the end, like, because you will forget. These notes, you will remember it, like, but anatomy is forgettable. So this one, we use it. Antiarrhythmic and local anesthesia with the lidocaine, novocaine. What else? We have the potassium channel blocker. You know, here, like for repolarizing the potassium. It's making repolarization and hyperpolarization. Potassium when leak out. So it's making what is repolarization. And we have drug the potassium if we block this channel blocker. Yeah, it's amiodarone.
What's this
Drugs they use, and also
for?
anti-arrhythmic drug, like for arrhythmia. We did like Razia. We did today the beta 1 blocker anti-arrhythmic. We did lidocaine anti-arrhythmic. We have potassium channel blocker, also anti-arrhythmic drug. They call it like amiodarone. Amiodarone, it's anti-arrhythmic also. What is the side effect of amiodarone?
Weakness of
What? Can you repeat your question?
What is the side effect of amiodarone? Example, I have arrhythmia, I came to you, you prescribe me amiodarone. So what can I develop? What you should to tell me, like to check each 6 months? They develop thyrotoxicosis. Yeah, you know, amiodarone is highly toxic to the thyroid, so they can develop what is thyrotoxicosis. Amiodarone side effect. Arya, Arshia, are you with us?
Yes, sir.
Yep.
Okay, so you are relaxing today?
I'm chilling. Yeah.
Yep.
Okay.
So amiodarone is highly toxic for the thyroid gland.
Yes. So it's making what is thyrotoxicosis? Thyrotoxicosis, like it's increasing T3 and T4. Amiodarone. We left with the calcium. Calcium channel blocker, which is working anti-arrhythmia, it is verapamil. So here we have calcium channel blocker, like working on the heart. We use it as anti-arrhythmic drug, anti-arrhythmic drug.
As in tired.
Yeah, because I confuse every name of drugs.
That's what I hate
Hello?
about pharmacology.
I like it, but it's too
Hello?
much for today.
Yeah.
It's nothing. Just you know what you do, you memorize it.
Because teacher, during the university, I was in my country, so
No, even
I
stay
don't
like
remember
in
any of
Ukraine.
them.
They never study. Just
So
put-
that's why I didn't study anything. Now it's too much for me because it's new knowledge. So I don't
so
know.
just make like today,
Mhm.
like with the drugs and the group and the use. Push them like where in the page. Before you open, you check it.
Okay.
And you can write it like with a small, like this hand, like notebook. So with your book you can carry when you are in the bus, like
Yeah, I
taxi. So you are like just because this you need to keep in mind. This is verapamil. Verapamil. Yeah, calcium. Hello, calcium channel blocker.
Verapamil is calcium channel blocker.
Yes, this one blocker. But we have another calcium channel blocker. We use it for hypertension.
Amlodipine.
Yes. We hypertension. They call it amlodipine, nifedipine. Any drugs ending by dipine. It is calcium channel blocker. We use it to treat hypertension because this one is working on the vessels. This one, verapamil, is working on the heart.
So when we have GP in end of the word, it's mean
Yeah, calcium channel blocker, but we use it for hypertension,
Hypertension,
not anti-arrhythmia.
Mhm.
How are you?
Did you read?
You are sleepy?
We had last night 8 to this one.
Good.
It has been a long day. Long.
Where's Muhammad? Muhammad Monday.
As always.
Yeah. Okay, so your class will be Friday. So guys, Arya, Arshe, and Nikita, I have a class